Hello, everyone, and welcome to this session entitled Women Who Use Drugs, Intersecting Injustice and Opportunity. It's organized by UN Women with support from Australia, UNODC, and the Women in Harm Reduction International Network. And without further ado, I'd like to ask Nazneen Demji from UN Women to open this session. Nazneen?
Great, thank you so much, Shauna. It gives me great pleasure to welcome you all to our panel event, Exploring Intersecting Injustice and Opportunities for Change for and with Women Who Use Drugs. The global HIV/AIDS response has made great progress in the past decades, including for women. More women than ever are on life-saving HIV treatment, and new HIV infections continue to decline globally. However, these successes are not universal across all women in all of their diversity. Unequal gender norms, marginalization and stigma, discriminatory laws and policies, institutional biases, all fuel the epidemic and hamper the response, limiting women's ability to access HIV services. According to UNODC, among 30 countries reporting data on women who inject drugs, HIV prevalence amongst women was 13% compared to 9% among men from the same countries. Women who use drugs also face multiple forms of discrimination, particularly in the context of HIV. Evidence indicates that women who use drugs and are living with HIV face huge barriers in accessing health services, particularly for prevention of mother-to-child transmission, even more so than women who are living with HIV. Agenda 2030 has established comprehensive commitments to human rights and gender equality for all. The goals are very much interlinked and require coordinated efforts among various actors and sectors. As such, we are excited to have been able to partner with WHRIN to underscore issues of human rights and non-discrimination in all efforts to achieve sustainable development. Reaching those furthest behind first will require tackling intersecting inequalities and prioritizing the most at-risk groups of women everywhere. To do so, I want to just highlight quickly 4 areas we think need to be prioritized. We first need better data and analysis to monitor and address the impact of multiple forms of discrimination on women in all their diversity. For example, there's a scarcity of data on violence against women in the context of drug use and HIV. Second, we must promote healthcare services that are accessible, gender responsive, and uphold the rights and confidentiality of all women, including women who use drugs, women living with HIV, sex workers, lesbian, bisexual, and transgender people, and young women. Third, we need evidence-based responses backed by non-discriminatory laws, policies, and programs, including harm reduction programs which should integrate gender-responsive actions that are financed with accountability mechanisms so we ensure we reach women who use drugs. Finally, women's leadership matters. Women who use drugs, including those living with HIV, must be involved in the design, implementation, and monitoring of national strategies and programs. As UN Women, we strongly believe that a critical dimension of the response to HIV is recognizing that women's diversities are a strength. An HIV response that values diversity and builds on women's identities and experiences will only enhance the outcomes. We need to support civil society and women's organizations who advance women's health and rights, who are critical in ensuring that women and girls have voice and agency, who are often at the forefront of identifying problems and experimenting with innovative solutions. I will stop here and once again, welcome to the session, and we're really looking forward to our discussions today. Thank you.
Thank you, Nazneen. I appreciate it. Just one moment. Yeah, and before we start, just a little bit of housekeeping. After the presentations, if there's time, we're going to take questions. So please put any questions or comments that you have in the Q&A section at the bottom of the screen. And please make sure to use the Q&A section for those and not chat, because we're going to be using chat for something else. In the chats, we're going to be placing bios of the WHRIN speakers, so you'll see that there. And we'll also add other links that are relevant to what's going on. Additionally, we have simultaneous interpretation for this session. Please go to the interpretation globe icon at the bottom of your screen, depending on what language you listen in. Now, we're very happy.
We need all of the best minds in our communities finding solutions to the problems we face. Too often, women's voices are ignored or overlooked. This needs to change. I also welcome this event's focus on the importance of full access to comprehensive HIV prevention and treatment for women who use drugs. The global HIV and AIDS epidemic remains an important issue for Australia. We will continue to actively contribute to the response, including taking steps towards ending the HIV epidemic by 2030, in line with Target 3.3 of the Sustainable Development Goals. Australia is a core funder of UNAIDS and pledged 242 million Australian dollars in the 2019 replenishment of the Global Fund, and which includes grant funding and technical assistance to countries in our region to expand access to HIV prevention, treatment, and to services to key populations, including sex workers and transgender people and injecting drug users. Collectively, I note that the Commission on Narcotic Drugs has repeatedly called on member states to strengthen their efforts to combat HIV and other communicable diseases and to address the specific and multifaceted needs of individuals at risk, and in particular, people who use drugs in response to the world drug problem. The 2019 Ministerial Declaration committed to ensuring that no affected person be left behind. Given that over 1/3 of people who use drugs worldwide are women and girls, this paper is indeed a welcome perspective. It is for these reasons that I'm pleased to open this event and welcome a light being shone on the issues facing women who use drugs. We know that gender equality and seeking out and listening to women are required to resolve the world drug problem and the challenges it continues to pose. Women's engagement in decision-making at all levels is critical to ensuring effective, practical, and incisive solutions, and so I commend the recommendations outlined in the paper. Thank you to UN Women for organising this event, and to the UNODC and the Women and Harm Reduction International Network for their support. I look forward to an interesting and meaningful panel discussion. Thanks, Shona.
Thank you very much, Ms. Clarke. And now it's my pleasure to introduce Alina Saranska. She's joining us today from Kyiv. Alina recently joined the Ukrainian army, so it's really a special honor that we've got her here with us today. And now I want to take just a moment to state that we at the Women in Harm Reduction International Network, we condemn Russia's violent invasion of Ukraine, and we stand in solidarity with people who use drugs in Ukraine and all of the people that are being affected by this atrocious war. So Alina, thank you very much for joining us today to introduce the advocacy brief that you co-authored. Alina?
Thank you. I don't have a translation due to technical difficulties, so I apologize for my poor English, and I'll try do it myself. Okay, next slide, please. Yeah, good afternoon. Today I will tell you about an advocacy brief created by the Women and Harm Reduction International Network, WHRIN. The brief promotes the principle of meaningful involvement. Women who use drugs have not often been heard in discussion about women's rights. It is time to hear our voices and create an inclusive approach to women's rights around the world. We promote human and evidence-based approaches to achieve health and well-being for women and gender non-conforming people who use drugs. Next slide, please. Okay. Thank you. Women who use drugs have been left out of discussion about gender equality and are often overlooked despite the gender stigmatization and structural violence they face. It is time to confront and change this exclusion. Targets set in the new global AIDS goals, as well as CG gender equality goals, cannot be properly met without inclusion of women who use drugs in all stages of service design, delivery, monitoring, and evaluation. Please, next slide. Thank you. Women who use drugs experience unique challenges reflecting interesting injustice related to their gender, social norms, and punitive drug policy, including high rates of imprisonment, discrimination, gender-based violence, and not access to medical and social services. Next slide, please. Prevalence of HIV among women who use drugs is higher than it is among men who use drugs, with prohibition disproportionate rates of incarceration, gender inequality, and gender-based violence convenient to increase HIV transmission risk. This is made worse by limited access to harm reduction and sexual and reproductive health services. Next slide, please. We don't have enough data on violence against women and gender non-conforming people who use drugs, but where it exists, rates are extremely high. Gender-based violence is linked with elevated levels of syringe sharing, inconsistent condom use, and overdose. Women and not binary people who use drugs and engage in sex work are subject to particularly high rates of violence and have very limited access to harm reduction services. Next slide, please. Thank you. Women who use drugs also face particular stigma in families and communities. For example, they are often seen as bad mother. In spite of the clearly gender impact of drug policy in many feminist spaces, there is limited will to engage with women who use drugs and the issue they face. Next slide, please. Some people imagine that women whose drugs lack agency or treating feminist goals around empowerment. Even in the women's space, women who use drugs are blamed for their disadvantage rather than being empowered to challenge harmful policies. This contradicts the feminist imperative to stop victim blaming. Please, next slide. Many of the ways prohibition impact women, including higher risk of imprisonment, sexual and gender-based violence, and not access to medical and social services, are linked to unequal gender norms. At the same time, women who use drugs are not accepted on equal footing in women's space. It is bad for meaningful involvement of women who use drugs in consultation of women's rights, healthcare, social service, and justice sector reforms. Next slide, please. As you all know, the Bangkok's rules urge countries to seek an alternative to incarceration for pretty non-violence offenses. But punitive drug policy has undermined implementation of the rules by setting the context for increasing incarceration of women and bad access to harm reduction services. Next slide, please. I would like to emphasize that the joint advocacy brief does not attempt to provide an overview, but it offers certain practical guidance along with some broad opportunities. First, governments must dismantle punitive drug policy to eliminate stigma, violence, and other human rights violations against women who use drugs. Stakeholders should ensure meaningful involvement of women who use drugs at all levels. Next slide, please. Stakeholders should support partnership between communities of women who use drugs and women movement and the HIV sector. Next slide, please. Finally, harm reduction services must become most responsive to the needs of women in all their diversity with government and donor support. Next slide, please. To sum up, I would like to ask you all to consider ways to meaningfully engage women and gender non-conforming people in women's movement and HIV platform alike. Women who use drugs are not invisible. We are right here and claiming our space at gender equality and decision-making tables. Thank you.
Mhm. Thank you, Alina. I feel like we should be able to applaud. And now I'd like to ask Putri Tanjung to tell us more about the campaign for elimination of violence against women who use drugs. Putri?
Good day, everyone. This presentation highlights how women who use drugs are fighting back against violence related to drug prohibitions. In particular, it will focus on the campaign to eliminate violence against women who use drugs, or EVA. Okay, next slide. Some of the types of violence caused by prohibitions experienced by women who use drugs include extrajudicial killing and death penalties, forced sterilizations and abortions, rape, sexual violence, extortions, loss of child custody, prison for simple possessions, and punishment for drug use in pregnancy. Some of due to the war on drugs, it is difficult for women who use drugs to report to police for fear of being harassment or worse, not to mention that sometimes the violence is from the hands of police. Next slide. Okay. Gender-based violence cannot be ended if those most affected are not involved at all levels, but historically, women who use drugs have not been included in efforts to address gender-based violence. So WHRIN coordinates a small grants program to support campaign led by women who use drugs to call attention to violence against women who use drugs. As with the WHRIN GBV campaign, EVA use the color orange and runs from November 25 for 16 days of activism, but with a focus on women who use drugs. Several women who use drugs groups in Indonesia have collaborated for EVA activities carried out across 3 cities in Java. For example, discussion was held with the Ministry of Women Empowerment about violence experienced by women who use drugs, and a YouTube channel on EVA was created. Last year, women who use drugs took action on a death penalty lawsuits at the Jakarta court office. A group lobbied the judge to reduce the sentence applied to a woman who used drugs, and the outcome was successful. EVA campaign led by women who use drugs are growing each year with participations across a total of 25 countries, running a total of 41 campaigns from all regions of the world since 2019. EVA campaign activities have included awareness raising through social media, the launch of lived experience books, films, podcasts and webinar, public demos, formal meetings with parliamentarians, police, health official and women ministry, self-defense classes, and more. The impact of the campaign has been felt in ways well beyond those originally anticipated, as well as catching the notice of government and the public. Some participating women who use drugs report a sense of vindication and empowerment. The campaign has triggered ongoing activities such as women-only days or serving editions, community mobilizations for advocacy action, and the establishment of new women who use drugs groups. In several places, evolved activity has led to the establishment of resource packs and expanded referral networks. We celebrate the bravery, creativity, and determinations of the activists involved. To learn more about WHRIN and our collective work on ending violence against women who use drugs, please see the links posted in the chat and visit the website. Thank you.
And now I would like to invite Monica from UNODC to take the floor.
Oh, thank you, Shona.
Mm-hmm.
Thank you. So first of all, I have to convey the apologies from Fariba. As I said, she was called in an urgent meeting at the CNB. So I will present on her behalf the presentation that we prepared for today. So let me share the screen. But I don't have the right to share the screen with you. So it says that, oh, okay, good. So now I have share. So this is the presentation. I hope
we can see it.
See it. Let's go into the presentation mode. Okay. So thank you very much for inviting us to present. As you know, UNODC is the UNAIDS lead agency for HIV prevention, treatment, care, and support among people who use drugs and people in prison. And our one of our major area of work, an initiative that actually was initiated in the UNODC civil society group for drug use and HIV, is the one that works on women and addressing their needs to access harm reduction services. We concentrate our efforts on 24 high priority countries for drug use and HIV and 35 for prison and for health in prison. So talking about the vulnerabilities that are faced by women who use drugs, of course, we should mention, as was already mentioned here before, the financial, the lower incomes, less saving, higher risk, even in a high income country, employment that was actually severely affected during the COVID, more responsibilities in the family, but also local traditions and different situations in different cultures, and domestic violence. In terms of the information that we have about women who use drugs, first of all, I should start by saying that not so many countries are collecting disaggregated data. So what the information that we have from various research, but we don't have a way of collecting systematic, up until now, although we are requesting and we are encouraging every year to have disaggregated data on gender. So far, not all the countries are providing this data. And there is an explanation for that. It's not only that there is a lack of capacity of collecting this data, but because of all the vulnerabilities that I mentioned before, is not that this is a data that is easily available, because people are trying also, women are trying also to protect themselves from the consequences of, revealing the fact that they are using drugs. But from the data that we have, we estimate that around 1/3 of people who use drugs are women. But what we know is that 1/5 of people who receive treatment or have access to care are women. Actually, from the new estimate, it seems that the number went down, and it's 1/6. Also, apart from lack of access to services, there are a lot of barriers to participate in policy development and in design of the services to address their needs, as women who use drugs are very rarely involved in the development of the policies or of the strategies, either on drug use or on access to healthcare related to drug use at the country level. So, very briefly, what support is UNODC providing to the countries that I mentioned before? We provide support to review drugs and criminal justice law and policies and practices. We ensure that HIV policies and programs are gender responsive. We, as again, I mentioned in my brief intervention, we focus on alternatives to imprisonment for women, including for drug use. We support and involve the community-led organization, community-based organizations, and civil society organizations representing women in program design, implementation, and monitoring and evaluation. And we implement and enforce measures to prevent violence, including sexual violence, both in the community and in prison. I would like to show you very briefly some of the guidance that we issued already. As I mentioned, all these papers are the result of ideas that were brought up in the meetings of our civil society group. We started with a policy brief and then a technical guidance on how to address the needs of women who use drugs. And then also based on a resolution that was adopted at the CND, a publication on prevention of mother-to-child transmission among women who use drugs. I'm very happy to let you know that we are also going to develop further the work and in providing technical guidance on addressing the needs of women who use drugs. Our next publication that is going to be developed this year is a technical brief that is looking into the prevention of gender-based violence among women who use drugs. As I said, we looked into how we can better implement the 9 interventions of the comprehensive harm reduction package and overdose to adapt them to the needs of women who use drugs. And we are building our guidance based on the normative guidance that is published by UNODC and WHO and the UNAIDS and other sister agencies. So we translated the comprehensive package into key interventions for women who use drugs, and we built capacity of many harm reduction colleagues working in the field to adapt this key intervention and to take into consideration how these interventions can be implemented in existing harm reduction services or in establishing new ones. And over the year, we trained over 2,500 service providers in face-to-face meetings when it was possible, and in the last 2 years in virtual meetings. We are also looking into prevention of mother-to-child transmission in prisons. There is, as I mentioned, there is a resolution of the Crime Commission on this topic. and developed this paper in collaboration with our partners from the civil society and from other UN agencies. And we are more advanced with implementing the prevention of multi-child transmission in prison, because we already have capacity building programs and cover a couple of hundreds of national policymakers and prison authorities in around 32 countries. So, and we'll continue also with the rollout of the prevention of child transmission in the among women who use drugs in the community. Of course, I would like to talk about what happened during COVID. And this is the reason that inspired us to move forward and prepare the paper on gender-based violence. Women had less access to services because of the law affected by the economic situation, and also from the data that we collected, it was more likely to report increased substance use but less access to services. So just to end here, what we are planning to do next is to continue our capacity building, also to engage with law enforcement and health staff, to continue to work on ending discrimination and stigma, to build the leadership in community-led organizations, to, as I mentioned, to continue with further technical guidance. Thank you.
Thank you, Monica, and thanks for jumping in. We really appreciate it. And so now we'll close the session. And as we do that, I'd like to thank the co-organizing agencies and government. I'd like to thank all of our panelists. I'd also like to thank Hannah, even though we had some technical difficulties with the interpretation. And I'll add a special thanks to Alina, who unexpectedly delivered very, very well in English. And I'd like to thank all of you for participating. Thank you and goodbye.